here today. First of all, I wanted to say welcome. Thank you all for spending some time with us today in our last HIMSS webinar of the summer. For those I haven't met, my name's Ian Mamengay. I serve on the Greater Kansas City HIMSS board as the programming chair. We've got a couple other folks on the line here as well from our board. If you have any interest in joining or getting more involved in the Greater Kansas City HIMSS board, please reach out. We'd love to have you. Before we get to our webinar for today, I did want to say thank you to our sponsors. We've got 2 ambassador sponsors that have helped with not just this webinar, but all the webinars and events throughout the year. So one of those is Pure Storage, and the other is Nordic Consulting. So a big shout out and thank you to both of those ambassador sponsors as well. As I mentioned, this is the last webinar we'll have for the summer. We'll pick up our programming in the fall. We'll have some other slots and additional webinars and in-person meetings. So if you do have any ideas or items that you'd like to present or see presented, please reach out. We'd love to have additional input on that as well. Specifically for today's webinar, we're lucky to have 3 gentlemen on the line with us. You can see their bios on the slide here, but we've got David and Patrick from Palo Alto Networks, and then we've got Dan from Phelps Health as well. And so specifically, they're going to discuss security with us today, and that's security specific to the medical devices as well. And so all 3 of them have a ton of experiences, and we're looking forward to it. So with that said, I think we'll turn it over to you, gentlemen. Thanks again for joining.
Thanks, Ian. Let me just share my screen. Okay, perfect. Thanks everyone for joining us today to learn about medical device security. Hopefully this will find beneficial to your overall roadmap for your organizations and help you get some insight in medical device security and medical devices in general and how that's looking for the future. So we know that connected medical devices are revolutionizing healthcare. There's no doubt about that. Basically, healthcare organizations that successfully adopt and integrate medical devices into their business models end up reaping huge benefits to this. Things like enhanced patient experiences by enabling quicker and more accurate diagnosis, reducing operational costs, basically overall improving patient outcomes, right? So due to this, hospitals also are increasingly becoming more reliant on medical IoT devices to deliver critical patient health care, which are used, of course, in a wide range of functionality and variety of use cases. So we're talking about everything from infusion pumps to vital sign monitors to surgical robots to equipment, for example, ambulance equipment. Also has a lot of smart devices included. Now, with this, there's also a greater increase in cybersecurity risk, and this is just going to continue to grow exponentially, right? So as we proliferate and increase this connectivity with smart devices in the healthcare field, Gartner did predict that there would be 1.3 billion connected medical devices in the market by 2030. Now that's a 244% increase from 2020. So there is obviously a race to innovate, and manufacturers are flooding the market with smart devices. And the issue here is that when these devices are manufactured and designed to increase functionality and for the patient, of course, security is not the first thing in mind. So we know that they're not designed with security in mind, and there's going to be a continuous issue that's exponentially going to grow because of that. So since they're not designed primarily with security in mind, many of these connected devices are shipped inherently with vulnerabilities. There was an FBI issued notice or warning a couple of years back where they warned about the risk of unpatched and outdated medical devices. Our own Unit 42 if you're not familiar with the Unit 42, they are our incident response and threat analyst for Palo Alto Networks, great group. They also issued a report recently, which identified as many as 75% of infusion pumps had unpatched vulnerabilities. And I believe 83% of imaging devices were powered by end-of-life OSs as well. With that, the report also further found that 98% of IoT devices communicated with unencrypted traffic. And 50% of all those IoT devices were also susceptible to high severity attacks. So we see that inherently there's large risk with the IoT devices in general. What I like to do is also focus on real known scenarios and real life attacks to get awareness of how real the danger is, right? The threat. So one of the examples I'd like to give is a attack that happened in the US. It was two hospital chains, Leon Medical Center in Florida and Nakona General Hospital in Texas, where hackers posted confidential patient data. They leaked it to the dark web. They pretty much had, patient files with personal and identifiable information, thousands of diagnostic scans with letters to insurers. All this was, it was basically a ransomware attack where they threatened to leak all kinds of sensitive data if, the ransom wasn't paid, for example. Another scenario happened also in Paris. So Paris, the CHSF hospital had a ransomware attack, and this was actually in August of 2022. And they also made it basically impossible for staff to access business software, storage systems, information systems, and it pretty much reduced the staff to using pen and paper due to this. Now, this ended up being a $10 million ransom. And eventually, after the investigations were done, the attack group, which was the Ragnar Locker ransomware group, was also linked to another great hack, which was on Greece's major natural gas suppliers. So these are big organizations that are aware of the vulnerabilities and aware of have a lot of knowledge on these devices, how they're being shipped with, not security focused. So they're looking to exploit these devices that sit there. Before I move on, one also great tip, the HIPAA journal did release also a finding where they discovered that 82% of healthcare organizations had experienced cyber attack on medical devices in 2020 and 2021. Now that was 3 years ago. So you can only imagine the proliferation from there until now and how greater that risk could be now 3 years later. So I took a whole slide to focus on one that you probably would have heard of, which is the WannaCry ransomware attack. Now, this is a serious one. That's why I wanted to keep its own slide and show you how that progressed and how that moved along, into the attack phase. So with the WannaCry ransomware, it was a global attack. It was pretty much, I believe in May of 2017, this is when it happened. It affected more than 150 countries. It was, I think in less than 24 hours, it was over $1 billion it cost everyone. The hardest hit here was the UK's National Health Service. And the slide here gives you an idea of how that developed. So starting from the left on the first one, what they did was basically they just scanned your network for open ports that was running the vulnerable Windows messaging protocol. So when they identified this vulnerability in the machines, they exploited it, gained access into the network, and that moves us into the lateral phase, step 2. From there, what they did is just replicate the same vulnerability. They replicated across other devices, which allowed them to then navigate and spread laterally into the network until they found their target devices. So they got to step 3 from there. And step 3 was when they released the payload. They injected the medical devices, which encrypted patient files, lock the devices, basically render them useless to use. So once again, if medical staff tried to access the records on a device or use the devices, they were blocked with messages on devices stating, this is the ransom demand. Please pay in Bitcoin. This is where you pay it. Now, this is identified as one of the first reported ransomware attacks on a networked medical device, and this was in 2017. Overall, over 70,000 devices were affected. That included MRI scanners, imaging devices, blood storage refrigerators, over 60 hospitals in the NHS network. So you're talking about, I believe it was 19,000 appointments were canceled over that week period of the attack that lasted. So this is just, an indicator of how serious it can be. Between this one and now, and the last one that I spoke of in 2022, you can see from there until now, there's been lots of attacks, and there's continued to be attacks, and hackers only have to be right once. So they'll continue to push, and that's their whole focus. These groups are just looking for vulnerabilities and continue to attack your networks daily, looking for any kind of exploits on these devices. Now, before I hand it over to Patrick and Dan, our panel, I just want to bring up one more report. Our own Unit 42 also had a report and assessment created from all the infusion pumps that they have on their systems. So of the 200,000 infusion pumps that they scanned on the networks, 75% of those that were scanned were known to have security gaps. Of that, 52% of those infusion pumps were known to have vulnerabilities, two or more vulnerabilities that had been disclosed back since 2019 that were still unpatched and susceptible to hackers. So I hope this information, it benefits you in a way to maybe take action or maybe improve your current security posture with that, or bring notice. And with that, I'll pass it over to Patrick and Dan. Thank you.
Thank you, David. Well said, well presented. We're really grateful to have Dan here. I'm going to let him introduce himself. Me and David are peers. We both represent, from an engineering perspective, this challenge, and part of why we wanted to be here and ask Casey Hims to be part of this is to really bring awareness to this and make sure that it's being discussed and being focused on. One of the things that me and David specialize in is healthcare. And within healthcare, our organization has identified sort of 9 key areas that are really creating the biggest challenges, it seems to be, for the for the provider group body. One of those is this space, this securing all devices, including your what we call Internet of Things, or IoT, and oftentimes you might hear it called in the hospital space IOMT, or Internet of Medical Things. So we wanted to bring Dan in, and he was gracious enough to come and do this. And so what we thought would be very effective is to have someone from your peer body talk about their journey from recognizing this challenge and then deciding how they were going to conquer it and moving through that. So Dan, thank you for being here. Dan, one of the things I learned in knowing you is that you wear a couple of unique hats. So before I launch into all my questions I have for you, I was hoping you could just take a couple minutes and introduce yourself around some of what you do for your organization, the different hats you wear, and a little bit about your background.
Yeah, sure. It'd be my pleasure. So my name is Dan Dunstetter. I am director of a cybersecurity department in healthcare organization in South Central Missouri. If you're familiar with Rolla, kind of positioned 100 miles from east of Springfield and 100 miles west of St. Louis on Interstate 44. We're a 200-bed hospital, and we have lots of clinics in surrounding counties. We service a 6-county area. We're kind of critical access healthcare organization, and we're kind of in that small medium size, which seems to be a sweet spot for bad actors, and it seems like we're at least seen as a soft target by hackers and bad actors. So we're constantly getting poked at and prodded and fished and socially engineered and attacked in various ways. So I wear that hat from a cybersecurity perspective. Lead a small team of 4 people. And then I'm also the HIPAA security officer for the organization. So responsible for implementation of the HIPAA security rule and making sure that those safeguards and standards are applied to our medical information and protecting our data from unauthorized disclosure and theft. So it's kind of my role. I've been with the organization for 19 years or close to 19 years. I've been in IT for 20 plus years, excuse me, the last 10 of which have been in cybersecurity. But my background's varied. I've done everything from server and data center stuff, lots of years as a network engineer. And the last 10, as I said, focused on cyber and really building our cybersecurity program for our organization. So hopefully that kind of helps give you some context as far as what I do and some of the challenges that we've been dealing with. And I'm sure a lot of those of you that have joined are in similar positions.
Excellent. Thank you, Dan. Yeah, I really appreciate in working with you that in the time that we spent together, that you don't just wear the I have a team of and a directive from a cybersecurity perspective, but you're also very focused on the policy and governing kind of controls around why we do what we do from a security perspective and a privacy perspective. I think it's super important to highlight. All right, so as we launch into our questions, one of the things we want to highlight here is that Dan has been through this journey, as I kind of mentioned, of recognizing this challenge and moving through it. And so I thought it would be good to take you all through that with Dan and kind of talk about how he's gone down that road. So Dan, the first question I have for you is, what made you aware or compelled to find this IoT or IOMT solution? What really brought this to your attention?
Yeah, sure. Well, I mean, a lot of the things that David touched on with the fact that medical devices are known to be vulnerable. They're often running an unsupported operating system with a ton of different vulnerabilities. There's supply chain concerns from the sense that there's a lot of people that are tweaking, changing, updating, touching these products all the time. We've had multiple cybersecurity incidents in our organization that were the result of a third party that had a support role for a medical device or system that was managed, maintained by our biomed team. And, the software update that they had was on their personal thumb drive that also had malware on it. So we learned from a couple different incidents, but it was kind of a combination of, hey, there's all this stuff out here that we can't control. It's growing, by the day, and the number of connected devices and the requirements for integration and connectivity were growing. And we were also kind of on the tail end of segmenting our network, going through a big network segmentation project, and we just realized that we still had gaps and we still had a lot to do and understand about not only our medical devices but our other Internet of Things devices, and we needed a strategy for that. So that's kind of how that came about. And it was a culmination of lots of years, and it didn't just happen overnight. So
yeah. Do you think that, and this is off a little bit from what I've sent you, but do you think that the conversation around this at the time that you were going through this is as loud or as forefront as it is today, or do you feel like that's changing a little bit?
Yeah, I mean, I think there's more awareness. So from that perspective, I think more people understand the risks. I think this is more on people's radars beyond just maybe your IT teams and your biomed teams. I think that there's a broader understanding across hospital and healthcare leadership as far as this being a challenge. and something that needs to be a part of your strategy for
Good.
protecting data. So
Good. That means people are talking about it, which is always a good thing. So when you were going in to try and tackle this, what were some of the requirements that you had going into finding a solution, going into that search?
yeah, so requirements for me were that it had to be effective at some level at providing me additional protections. Right. And then there was a lot of not necessarily requirements, but kind of like nice to haves. So I was looking for something that kind of fit into our platform. Um, we're being a smaller organization. We don't have the bench that's deep enough, nor the budget needed to pursue kind of a best of breed approach where you just kind of go out and pick the best technology that you could find. We have to kind of look at what is our platform and can we find something that integrates well, or maybe is a solution that's provided by the same vendor that's doing these other 1, 2, 3, 4 things for us. So that was certainly something that we were looking at. And then we just realized that we had a major inventory issue too with this. So we started to focus on how can whatever product we're looking for also help us from an asset management and inventory perspective, as far as just identifying and enumerating what all we already have, to a degree that was accurate enough where it was like, okay, this makes sense, because working with our biomed team, they have an inventory, but like having to coordinate and share, and then their system was in an environment that was outside of ours, so there was challenges around access, and we just wanted something we could control ourselves too. So inventory and asset management became a requirement for what we were looking for too, Patrick.
Awesome. And then just out of curiosity, along with that same school of thought, prior to going down this road, did you have any visibility into these devices that was in your team's hands? I mean, like just knowing, I mean, to your point about inventory, could you even see what was out there prior, or was it really kind of confuddled?
No, visibility was minimal. I mean, we had vulnerability scanning systems that were looking at some of these devices, but we weren't able to like really aggressively scan them. And a lot of the vulnerability scan data wouldn't necessarily tell you what you were looking at, right? You might know that you're looking at a Windows 10 device that's, running IIS and, has these services on it, but it doesn't tell you that it's a modality for something, like a PAX modality or whatever. We were able to kind of correlate some of the vulnerability data with IP data and be like, oh, okay, well, we know since it's on this network that it's this type of device or it's physically in this area, but nothing more specific than that. So
Okay.
it
Interesting.
was a blind spot for sure.
Excellent. Good to call that out. When you went, as you're going through the search, was there anything that maybe you hadn't thought about that was brought to your attention from these different partners that were trying to solve the problem that highlighted value to you, right? Anything that maybe you went in with certain expectations and then in the actual pursuit found some things that you hadn't thought about or that opened your eyes to some other issues?
Yeah, I mean, what comes to mind, because I really didn't know what to expect, and I was excited to find out that Palo Alto had an IoT solution. I just didn't know, how fully realized it was. Was this something that was like, purchased and then quickly bolted on? So I didn't know how well it was going to like integrate and play with the rest of our technologies. So being a Palo Alto shop from like an endpoint protection perspective and a network threat prevention and a couple other areas, it was really cool to see how the Palo Alto IoT product integrated, especially with the next gen firewalls and the ability to kind of real time build firewall policies that could be imported and then implemented, and really kind of streamline the segmentation of these devices. So that was like that was cool and huge and probably the biggest selling point for me. So I don't know if that's really what you were kind of alluding to, but that's what
No,
done for me when you asked that question.
yeah, no, I mean, I just for me, it's candidly just as you went through that, it sounds like to me, you set out with your initial challenges and expectations. We have a slimmer team. We need something that's operationally effective. And you were surprised in your pursuit to find something that fit that narrative. That's good. That's important. Just knowing that there's options out there, I think is really good for everybody to hear.
Yeah, there are sorry, before you jump on to the next
Oh, it's
question
okay.
too, I will say we looked at products and the security world is so saturated with products. Like if you have a need, you can go find 10 things that are doing it. One thing that was a surprise was I found, or at least in my experience, that there aren't a lot of really good fully realized products that are fitting this need. I think there'll be more, and I did see some that there was. I looked at some other products that were good too. They just weren't necessarily the fit that I was looking for. But I was just surprised that this wasn't a bigger focus, and there wasn't more, um, you know, companies that were bringing, fully realized products to market. So
Yeah.
that was kind of an interesting find. And again, this was not a really long time ago, maybe 2 years ago when we kind of started down this path. Um, Less than maybe a year and a half ago, actually. So a lot can change in a year and a half. Maybe there's a lot of stuff out there now, but at the time there really wasn't much.
Yeah, it seems like in this world, everything can change overnight. Um, Kind of as you came out of the search, right, and you'd found something that you were kind of coming to a point where you had to make a decision on whatever you were going to use in your environment. Um, did you find that your requirements or your expectations had changed at all after being introduced to these technologies? Were pretty much the same set of requirements you went into the search with, and it didn't derail your pursuit.
No, I mean my requirements shifted maybe a little bit. I think once I realized that I could do more than I initially set out to do, that kind of maybe changed some requirements, or at least helped us realize that we could build our roadmap out a little bit more and find other ways to get value out of trying to tackle IoT and Meta IoT. So, and those are things that we're still working on and developing. I mean, we've got the product implemented, working, and we've gone through the segmentation of a lot of these devices, found a lot of vulnerabilities, locked a lot of stuff down as far as finding things that had default passwords for FTP servers or web servers that they were running. Things that were exposed to the internet or connected to other networks internally that they shouldn't have that presented risk. So we got a lot of mileage out of locking the environment down, but there are other ways that we can coordinate with Biomed, our Biomed team, to help keep things patched and address other vulnerabilities in places where we, don't have any control. So there's inroads there for us to coordinate and work closer together on securing the environment from that perspective. And I'm excited about those things, but we haven't fully realized that potential yet because honestly, everybody's just so busy and trying to tread water or keep up. But it's it's good to know that that's something that we can do later on down the road.
Yeah, I call it the do more with less effect. Which kind of leads me to my next question. So I have a clinical engineering background. Um, with the Biomed clinical engineering team, your relationship before you were looking at this and your relationship now, has anything changed? Has it gotten stronger? Sounds like you guys have started to sort of coalesce more on what's important to both teams and work together to pin those down. I'd love to hear how that's evolved for you.
Yeah, no, it's been good. We've always tried to partner with clinical engineering or biomed. They actually go by clinical engineering in my organization, but I just forever biomed for me for some
Yeah,
reason.
most
Um,
people.
yeah. So our biomed clinical engineering leader attends our weekly security briefings, and he would skip a lot of meetings. Since we've had this product and we're starting to report more on this, I've noticed that he's like more engaged. He's showing up to the meetings. He's got more questions. We're talking more after the meetings and outside of the meetings and stuff about
Good.
these types of things. So that's been good.
That's excellent. I mean, I've watched that part of the organization grow and develop for a long time, and I think it's great that you guys are doing that, and that's the outcome is more skin in the game, more accountability, more involvement, rowing in the same direction. Those are good things. Well, the next question I had is very similar, but overall, as an organization, has the solution that you've implemented, has it changed your organization? Has it changed the way your teams work? Has it done anything beyond just, hey, we wanted to see these things, we wanted to be able to write security policy around them? Has it evoked any kind of change from a financial perspective, from a planning perspective? You mentioned some strategic roadmap stuff has changed. I'm just wondering if the impact of a tool like this, to some of David's information about the vast amount of these devices that exist, if it's proven to drive change anywhere else, even from just, hey, now we have data and analytics on some of this stuff.
Yeah, and that's really it. You've got the data and the analytics and pretty good reporting front end, against that data that you can leverage. Choose your own adventure. How much time do you have? How important is this to you? Where is this on your roadmap? What is your risk analysis or risk assessment processes look like, and are these types of things in scope? It just opens up a lot of doors from that perspective. So we've just got a lot more data to leverage and work with. We've got capabilities we didn't have before. So those are the major impacts, changes from that perspective.
Yeah, I mean, we're in the age of data, right? Being able to have that to back. I know a lot of decisions can't be made without a good argument and a solid set of data. So it's good that you now have that. And then finally, again, part of asking you to come and do this and bringing you here and speaking to a set of peers, a body of peers, what would you recommend to your peers to help them prioritize, maybe articulate the value for this challenge of their organizations? If anybody's not doing this today, they don't have a line of sight. What do you think your recommendations are, having gone through this? What would you do if you could do it again, and how would you do it?
Well, I mean, honestly, I don't feel like I would do too much differently. I think if I did it again, I would kind of arrive in the same place, make the same choices that I made before. As far as advice, I have a feeling this is on pretty much everybody's radar. I have a feeling that most people are looking at this and either or have plans to find solutions or already have something. So yeah, if not, I think this is something you should be looking at. So it's always been kind of in our top 5 or 6 concerns or issues, and I don't see any sign of things really improving. I mean, the FDA has made things a bit more stringent. They've at least put some onus on the manufacturers and vendors to make cybersecurity a priority. So we're not dealing with the same type of arguments from these vendors that we had before, as far as, well, you can't change this as an FDA approved device, you can't change it, but just know what you have, I guess. Know what's out there. Make sure that you have the knowledge. The knowledge is the power. If you don't see it, you don't know. You might have a blind spot. Just do what you can to get visibility into what you have connected. Because I can tell you that even though there's a higher standard for security, these systems still have tons of holes, and they're not coming configured appropriately. And the guy that showed up to install your lab analyzer or whatever it is, he's in and out unless you're telling him. what default passwords changed and services shut down and your endpoint product on it or put on the right network or so on and so forth. It's not going to get done. So make sure it's on your radar and part of your security program.
Excellent. Thank you, Dan. I think that's relevant to all parties that hear it. Whether you're a project manager, biomed, network engineer, security engineer, even providers and nurses, I think need to be more aware of the risk. Everything's got a USB drive. Everything's networked these days. It's all connected. So I really appreciate that. Dan, I don't have any other questions for you. If there's any ending remarks you'd like to share, be my guest. But I mostly just really appreciate you coming here and doing this and taking the time to walk through this, because I think it makes it more approachable for everyone. It shows them that it's simply an information gathering event that you balance against what you have operationally to work with, and making a good decision for your organization to be aware of this gap, to fill it, and to start putting eyes and resources on it. So I really appreciate your time.
Oh, it's my pleasure. Yeah, I appreciate the opportunity to talk to other people in the field about this stuff. I hope that this conversation and David's presentation has been informational and applicable. So if there's any questions at all, happy to stick around and talk to anybody that's got questions. So
That's a good point. If there's anybody on who wants to submit any questions, they can use the Q&A. Also, I think the chat is open. We left a little bit of time for that. Be happy to field any questions if you have them. We'll give it a minute or two to see if anyone is eager to throw something in there. You could even ask me about my goofy haircut. I won't get upset. I don't see any coming in. We'll give you guys a minute, but I think our intention, I put in the chat, is to send our slides to the HIMSS team. The HIMSS team is recording this, so hopefully you'll get the recording and the slides. And if you have any questions for myself or David, I know we were hoping to get our information put in there for you. If you just have any questions, I don't know about Dan, but we just make ourselves available to you anytime you want to get any information we can help you with.
And I'll just jump in. I want to say thank you again to you three. Specifically, it was a great presentation. I can speak for myself. I definitely learned a few things, and it's a relevant topic to many. So thank you again. As Patrick mentioned, we will be posting the slides and the recording of this to the HIMSS website, and certainly reach out if you want to get in touch with anybody. It does look like maybe there's a couple questions popping in there.
Excellent.
I'll let you field those. Yeah.
Yeah, excellent. So Dan, you might be able to help with this because I'm not familiar with it. Are you familiar with the HICP, which would be the Health Industry Cybersecurity Practices, and their section on securing biomedical devices?
Yeah, I am familiar with it. I can't say that I'm an expert. I assume that it's kind of intuitive, but I don't know that I'm aware of its existence, and I have read it, but beyond that, not an expert on that. That's a good call out, though. It's always good to know that there are best practices that are being shared, that are established for the industry. Is that something that's fronted by Health and Human Services, or is that an FDA thing?
We'll see what we get back. My guess is that might be something that's come through from like an AMI channel, like a biomedical device, consultancy group that's working probably with the government to put that out. But we'll see if we get some info on that. The next question is there any specific software to protect medical devices from cyber attacks? Me and David can talk a little bit, and then Dan, if you want. So I used to work for Children's Nebraska as a clinical engineer. I did that for about 2 years, and I worked across pretty much all their products except for some of their imaging stuff where new guys, it's kind of like, hey, stay out of the way. And then I moved on to work for Philips Healthcare, specifically in their patient monitoring, data analytics, and integration division. I was an engineer for them and then a consultant and kind of moved up through that same vertical. What I have seen is that there's not specifically software dedicated to medical devices outside of whatever the OEM is doing. I've seen things like the OEM, which would be the manufacturer, soliciting a third-party security audit to test their devices and determining, hey, you need to change the way that you're doing these things. But with information technology products, you might deploy what's called EDR, endpoint detection response, or XDR, or antivirus or something like that. Most medical devices I've come across, there's sort of a friction between the manufacturer, the FDA compliance of what they've submitted to the government to say this is what is actually applicable on here. Sometimes they'll allow certain antivirus softwares like McAfee or any of those things. I think we'll see that grow, what's allowed and what is approved and vetted and tested on those devices. But from my experience, I've not seen a lot of that. I don't know about you, Dan, if you've seen anything different, or David, but that's kind of what I've seen happen mostly in the market. Is this is what we've tested and submitted to the government for, and if it's not on this list, we don't approve it with use with our devices. And then most people get a little confused about putting any specific software on there at the detriment of a patient population.
Yeah, I would agree completely. I think depending on where your IT or cybersecurity teams are with the procurement process and implementation process, you should at least have an opportunity to ask if you can put your endpoint protection or other kind of cybersecurity software on the device. And I think you have the right to ask and should push a little bit, and hold them accountable. If they say no, make them explain why. And then if you can't, have your software agent installed, your endpoint for your EDR, your XDR, your antivirus, whatever, installed in that device, then you have to look at what other compensating controls can you use to protect it. And then you shift to kind of network protection strategies and other strategies. So that's the only thing I could add to that.
And to just add on, I know that we have probably a lot of people that aren't technical. Kind of what beyond the actual software that would go on the device itself, Dan alluding to network protection. Part of what we're talking about in this space as a solution is gaining visibility, like Dan alluded to what is actually in your environment. So you've got these 70,000+ devices. Well, where are they and what are they doing, and what's their impact downstream to patient care? And then ultimately, beyond visibility, segmentation, as Dan mentioned, really is the effort to make sure that the devices that are operating in your environment are relegated to a space in which they're going to, let's say there is an incident, you have an attack in that space. The idea is to control its ability to move through your network by segmenting it and putting it into pockets. So it gets trapped in that segment, and you can kind of contain what we would call blast radius from that perspective. And so taking that visibility a step further, I think you'd probably be looking for something from a network perspective that does enforcement, right? So if this device group is doing these things, I want to make sure that this is the reaction that happens, and this is how it plays out. My team is alerted, that segment is shut down and locked down. Dan mentioned a lot of things about making sure certain devices were locked down and things like that. So visibility and enforcement are two big pieces to that outside of just the software on an actual end device. So to take that a step further, let's see. Dan, just for all of our education, it looks like you responded. The HICP was collaboratively developed by HHS and private industry. So that's good to know. Again, conversations, organizations coming together, working together to try and solve problems, which is, I think, why we're all here. The next question we have is, what is the best way to detect and report a cyber attack for medical personnel? Dan, I don't know. It sounds like you've had some stuff. I'm going to let you speak to this because this is your industry. And I've been to some conferences where they've spoke on this, but best practice is sort of, I think, elusive at this point, but I'd love to hear what your perspective is.
Yeah, sure. I mean, I think the only thing that I could say to this is to know what your organization's incident response policy looks like. And I think the key thing is that you're reporting anything suspicious or anything obviously malicious, and you're reporting it as quickly as possible to the appropriate authorized people in your organization. And ideally, your organization has policies that define kind of as a medical professional what your role and obligation is, and how to report. So you should know the reporting tools and reporting methodology. And I say there's report early and often. It's better to report something that doesn't turn out to be an incident than it is to assume that what you saw was really not that big of a deal. So I encourage everybody at Phelps to report if they even have an inkling. If their spidey sense tingles or they see the hint of a red flag, let us know, because you never know how these data points can correlate. So,
Yeah, excellent. David and I actually had the opportunity to sponsor and be involved with an event in Kansas City very recently that was for the communications groups of hospitals. They had the FBI there to speak, as well as the health system that had been breached and had gone through a cyber security incident, right? They had to shut down. They taught, and because it was a communication-based forum, they talked a lot about how they communicated that both internally in the organization and externally to the world. And one of the things in talking about specifically how to detect and then report that down to medical personnel, once the way that it was relayed to us is once they had realized the situation that they were in, the situation beyond what Dan's team would be doing, which is incident response, how do we contain, remediate, scrub, and bring things back online, right? Executing what I think we would call kill chain in the environment. There is this other aspect that's social political and making sure that you inform, your personnel, hey, here's what's going on. What we had heard from them was that what was very effective for them was they had to immediately establish a confident communication chain of who was speaking to the outside world and who was going to be the sole voice for that, and then how they were going to distribute information down through their clinical teams, all the way trickling down to their patient bodies and patient families. And the only thing I can really tell you that I learned from that is, if you have not had the opportunity to go listen to a health system like that speak about their experience, I highly recommend it. It was incredibly informative. Everything from, they happened to have an in-house print shop, and that drove their ability to print off pamphlets and keep that line of communication open internally, which resulted in also being able to print off nursing forms for manual charting and constantly kind of adjust them based on what they had found their needs to be. It's a very wild experience. I think it's still relatively new, and the size of the organization changes a lot of what the impact is downstream, but highly recommend you take the opportunity to go and listen in if anyone's willing to talk about those experiences, because they're incredibly eye-opening. I don't know, David, if you had anything to add to that, but that was kind of what I've taken away in that whole experience.
No, Patrick, that was great. Thank you. We do have another question though.
Okay. Tips to buy new medical devices for functionality. Tips for buying new medical devices when looking through the lens of functionality and security. Dan, I don't know if you have anything to say about that in your new relationship with Biomed. I can speak a little bit to what I've seen, but I'm more than happy to pass that baton if you want to take it.
yeah, I'll take a stab at that, and then if you have anything to add, then feel free. But I would just say try and ask the right questions prior to purchase with regards to what is the technology underpinning the medical device. I mean, obviously you're getting a medical device because it fits a need in whatever clinical or inpatient setting that you have, but make sure that the right IT people are present to ask questions like, what operating system is it built on? What are its communication requirements? How is support provided? Can we put our endpoint protection product on this device? Those types of questions will help paint a picture of what the vendor is willing to do and what your overall risk is in having that device connected in your environment.
Yeah. The only thing I can really add on to that, because I think there's always going to be sort of multiple lenses whenever you're approaching a purchase, especially most medical equipment, big capital purchasing, right? I need to buy 1,000 pumps. I need to buy an MRI machine. These aren't cheap investments. They're big investments. When I was on the hospital side, a lot of what we looked at was what Dan had stated. That's matured a lot in terms of requesting information from the vendor on what have you done to make sure this device is secure? Are you encrypting that information as it passes over your network? Are you putting any security policies or any security software in play with the equipment? Can you divulge any incidents that have happened that we need to know about, right? Do you have any critical vulnerabilities in your software currently? What are you up against? And then really taking that and funneling it through that functionality piece, right? What I think Dan stated applies to this question as well, and really any question when it comes to implementing a new solution, which is know what hill you're trying to take. Know what functions and things that are necessary. I need to deliver this outcome. I need to deliver these things. This is the need that I'm shopping for. Whatever I learn in that journey can be applied, but this is the needs. You may find new needs come with that, but I think that that's a very good place to start from the side of starting to gather information on what's available to you. The other thing I'll say is being on the OEM side and working through, hey, how is my organization handling these questions? To Dan's point, there's a lot of pressure now on the vendors to be more open-handed and more cooperative in the space. So asking those questions should absolutely guarantee you an answer of some kind. You may not like it, but it should guarantee you an answer. You have the right to request paperwork from these guys and secure that in the pursuit of, hey, ultimately I'm going to have to report to Dan's team what kind of risk that we are going to be taking by putting this in our environment, right? So you have what you need. And then really, when you get to that security piece, what you're really assessing is risk. I always joke with David and our peers that unfortunately, some of what we do is a lot like insurance, right? It's, hey, I'm here to sell you volcano insurance, right? Watch this. There's no volcanoes here. So what's my probability versus possibility? The possibility of you getting breached is always there, as well as the probability. So you're really just doing a measurement of that. And I think when you factor all those things together, you end up with what function am I getting? How secure is it? What risk are we taking by deploying it? So I hope that's helpful. Any other questions? Excellent. I don't see any. David or Dan, if you have any departing statements, please go ahead. Otherwise, Ian and Heidi will turn it back to you guys to wrap it up and get these guys on the road.
Just want to add, I did put in our contact information in the one of the slides. So we are sending it out. It'll have our contact information for everyone to have.
Wonderful. Well, thank you all again so much for presenting, and also everybody else for joining. We'll land here, but I hope everybody has a great afternoon, and we'll post the slides and recording it as soon as we can. Thank you again. Take care, everybody.
Thank you. Bye.